Our next speaker is Dr. Shanti. He specializes in spine disorders, spine care, minimally invasive spine surgery.
So now we're going to segue and just show a little bit of pictures of the different operations that we perform in the spine. We're going to do a little bit of the open, traditional surgery and some of the recent minimally invasive procedures that we're involved in. So this is a traditional spine surgery discectomy, a very good operation. You make incision in the back. We're going to reflect the muscle off the spine to get down to this small piece of bone, resect this bone to get to this bit. So here's another option how we can do the same operation, but in a less invasive way. We can do it through a tube. And this is what it looks like. You're looking down this little 20mm tube, and here's the herniation. That's all we need to do. So most people think of minimally invasive surgery as a small incision. It looks pretty, but that's not what minimally invasive spine surgery is about. It's what we do below the skin that makes it minimally invasive. It's respecting the patient's musculature and spine anatomy. Let's talk about one of the more commonly done post-open fusions. It's called a posterior lateral fusion. What's the problem? You even have to do more dissecting than the laminectomy people, the people that had the decompressions before. Why? Because I have to go even further out to be able to put bone graft on the side. Another form of open fusion is called an A-lift, which is essentially doing a fusion by going through your belly. As a spine surgery, it's actually a good operation. It allows me to put a huge, nice disc, beautiful space for bone graft, restore alignment to the spine. What's the problem? Just like the back. It's the approach that makes it the problem. It's morbid. You need a vascular surgeon to get you down there. That already tells you, that means there's going to be some dangerous vessels in the way. Look, all this work that has to be done just to get to this little tiny disc. So what about doing a minimally invasive fusion? You can do it from the back. So look at the difference between minimally invasive versus open. An open surgery would typically means reflect this muscle off the spine, reflect this muscle off the spine. And we could do this in a 26mm tube. All this done through this. But it's not about the size of the incision. It's what we do beneath the skin is what makes it minimally invasive. Direct lateral. This is by far one of my favorite surgery, my partner's favorite surgery. We do this a lot in our center. So now we're going to do a fusion, but we're going to avoid all the scary things in the front. So we're actually going to come from the side. And we're going to go straight down to that disc. And you can see it. We're going to use a small single incision. We're going down with the cameras. Here's the x-rays. We're monitoring the nerves. We're already down onto the spine through the stuff. And you're looking at what I see. We're already down there. This is it. That white is the disc. The operation is done. Look at this. This is a great illustration of how this technology could be powerful. This is a 7-year-old patient, severe scoliosis, back pain into the leg. And this was done through this. I tell my patients, an educated patient is a healthy patient. This is your back pain. Take ownership of it. Be involved in your care.